Let's talk about vocal anatomy. Now, this can be a very scientific, heavy, complicated subject, but I want to give you the basics and the things that you need to know that are relevant to the singing process for your benefit, not for your confusion. The first thing we want to talk about is the actual vocal cords themselves, also called the vocal folds. Now, if my fingers attached to each other like this are representing the two bands, the two lateral bands of muscle that vibrate against each other as air passes through. Those are your vocal cords. Then you've got the arytenoid muscle. Now, the arytenoids are responsible for putting a gentle squeeze laterally on the vocal cords, which compress them together and create a sometimes more powerful sound. They also can create a crying kind of sound, like a baby cry. That squeezed, strident type of quality. Now, they can overcompress and they can actually undercompress. We're just trying to find a balance of compression and try to be in control of what the vocal muscle is actually doing. Now, where do the vocal cords live? They live inside of the larynx, which is also known as your voice box. And this is just the housing center for the vocal cords themselves. You might hear somebody talk about how we want to sing with a neutral larynx position. And it's that front notch right here, also known as like the Adam's apple, which is the front of the larynx right here. And both men and women have an Adam's apple. But that's that position. So if you put your finger right there on the larynx and then you swallow, you will feel the larynx slide up and then pop right back down. Now, you can lower the larynx with a type of tone that you can produce that's somewhat dopey. If I go, whoa, 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 ba, 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 my larynx comes down low. Or if I'm either super nasal or very pushy and strident, then I'm going to have a higher larynx position, like, my larynx is going to go up high. Typically, we want to have a neutral larynx position because that's that natural place where there's not a lot of muscle pulling on it and it's not an exaggerated, dopey sound that's forcing that thing to move up and down. We want to really limit the range of motion that that larynx is going to have so that you can stay very, very relaxed when you're singing. Another relevant vocal anatomy piece of the puzzle is your pharynx. The pharynx is behind the soft palate and it sends sound up through the pharynx and into the nasal cavity. Now, that space is really responsible for creating a nasal and powerful, loud, resonating space for your voice. It can help take a lot of pressure off of the vocal cords themselves, shouldering the burden of power without having to rely so much on the muscle density side. Then you've got some of the not so great parts of the singing process. These are not really vocal anatomy terms that are for the singer, but more in the abuse of singing. And one of those is called the digastric muscle. If you take your thumb and you press behind the chin bone right here and swallow, you'll feel a muscle tighten up and pull straight down. That muscle, which is responsible for swallowing, along with the hyoid bone, those are really good for eating and drinking, but they're actually kind of bad for singing. They promote a pulling rather on the vocal cords that ultimately will result in those cords splitting apart, your voice cracking and breaking, producing strain, producing fatigue, and just soreness, a general sense of uncomfortableness around the throat area. When people say that their voice hurts or their throat hurts after singing, it's actually not the cords themselves that they are feeling pain associated with. They're actually feeling the soreness of the surrounding muscles, the external muscles of the larynx that are not supposed to be used in the process. Because if you're singing properly, you're not going to feel pain. You're really not going to feel a whole lot of anything. And that's actually because there are no nerve endings in your vocal cords, which I think is just a fun fact. There is still sensation involved in singing. There is still muscle use and engagement in the process, but it's not painful if you're doing it properly.